Hey everybody, I'm back. Hi everybody, right? This is Rebound Your Health TV with Dr. Z. I roll with it. That's what I call MVP behavior personally. I'm gonna roll with it. Hopefully those who are joining us, it was quite a few of you actually, and I appreciate that. I really appreciate your patience with this. I'm actually back. I'm right back in here. Hopefully you can see me. If you're here, please tell me, hey, I see you. You're there. You're live now. Internet is internet. It's going to be what's going to be, but we're going to keep it moving. Hi, Ty. Hi, Sharifa. Thank you for joining us. Welcome to the broadcast. MVPs in action. I see y'all. That's what I'm talking about. Right here, ready to get it in, and I'm going to be right here with you. We apologize for any technical difficulties. Unfortunately, I do not control the technology. However, I'm here, and I'm going to stay here as long as technology allows it. We've got to keep it moving regardless. So if you can please, if you saw somebody in the broadcast probably like really 5 minutes ago, bring them back in. Invite one person to the broadcast so they can get this information. Say hi when you get here. Hey, Dr. Lakeisha. Wow. Thank you for joining us. Welcome to the broadcast. Please share this video. Invite one friend. We're going to get into this. I really want to bring in some information I feel like is underutilized information and just not very well understood information. And hopefully, the more we bring videos and broadcasts like this, that means everybody could be a little bit more informed, have more conversation, and realize that there's more options out there besides the pill, okay? And also that not all pain is due to being inflamed. That's actually what the point of this conversation is about. So please share this video, invite one friend. We're going to get started in about 60 seconds because there's a few of you got, like I said, that were trying to join into the broadcast. Technology tried to interfere, but whatever, we're here. We're going to keep it moving, and we appreciate that. So come on into the broadcast. Sharing is caring. So hi, Dr. Rashana. Hi, Jamila. Thank you for joining us. Please share this video. Welcome to the broadcast, and invite one friend. Thank you for coming back to the video because I do recognize some of these names that were in the video, the broadcast just about 5 or 10 minutes ago. So welcome back to Rebound Your Health TV with Dr. Z. We're going to get right into this in about 60 seconds, but please invite, maybe you saw a few people here. I know Dr. Charlotte's here. Hopefully you can join back in. And there are a few others, but literally about 60 seconds, we're going to jump right into this conversation. I'm not inflamed, but I'm still in pain. What is that all about? I'm going to basically break down what is inflammation so you have an idea of why we're having that conversation in the first place. And then I'm going to break down some terms that are not necessarily readily used in a regular conversation, but they're important, I think important words, if you will, and concepts for us to understand why I'm telling you that. That's how I am. I'm big on educating you and empowering you so that you actually understand how things help you, why certain things don't work, and how you can maximize and optimize your body function to work for you, right? That's what it's all about. So that's been about 60 seconds. Welcome to the broadcast. Please invite at least one friend into the broadcast so they can get on in. For those of you that don't know me, I am Dr. Zarina, also known as Dr. Z. I am your integrative sports medicine and integrative pain management physician. I am here to help you through my private practice, my concierge program, another program that I'm actually excited to tell you guys about toward the end of this video. Hi, Mr. Bala. Thank you for joining us. Welcome to the broadcast. And also through speaking engagements, nationally, locally, whatever, and as well as broadcasts just like these to help you get to your next, help you prevent pain as well, right? And not just get out of pain, but prevent pain as well. So that's what this platform is all about. It's all about you, the MVP, the ones that listen to my voice who can see my face on this video right now. Okay, so let's jump right in. Okay, so first of all, why did I name this episode Inflamed but still not inflamed but still in pain? Because a lot of people think that their pain is due to inflammation. So one of the first things they think to do is grab Motrin, even if it's been like a year or 2 years or 10 years that they've been on something, which is technically an anti-inflammatory. They may grab they've been prescribed potentially what we call Schedule 2 medications or Percocets and hydrocodones and so on and so forth. They have their place. I'm not here to knock narcotics. I'm not here to knock opioid medications. What I'm actually here is telling you is that everything has a place and not everything is going to be fixed through the pain pill, okay? Quite frankly, pain pills in general, for those who didn't actually realize it, they were not designed to make you pain-free. They weren't designed to take your pain from severe to zero. They were designed to reduce and quote unquote manage your pain, but they were never necessarily designed to treat the root cause of your pain. Some of you kind of conceptually know that, right? Hi, Dr. Nicole. Welcome to the broadcast. Mwah. Thank you for coming to Rebound Your Health TV with Dr. Z. And please join us and invite one friend to hear this information, right? Some of you knew that already. Some of you didn't like, some of that for you, that's an aha moment. What? It's not designed to treat, then why did they give it to me in the first place? It's because for all intents purposes, I'm not going to get political or social political with it, but in general, it's given to you because from a medical perspective, because that's what the medical field traditionally, right, conventionally knows to do when they can't quite fix the root of the problem. And what I'm really here to talk about is, what is that then? What is happening? If it's not inflammation, what actually is it that's happening to me, right? That's happening to my body, or what's happening to my friend's body, my mom, my brother, my cousin, my uncle, yourself. You're the nurse, you're a doctor yourself. You might work in construction. You might sit at a desk job mostly. You might be in banking. You might be in business. Whatever you are doing, you may have had pain. Hi, Dr. Shar. Thank you for joining us and welcome on back. Welcome back to the broadcast. Whatever you're doing, especially once you get past that 3 to 4, even 6 weeks of pain, more commonly than not, it is not inflammation. Is this foolproof, like zero inflammation happening whatsoever? No, I'm not saying that. But I am saying primarily what is happening is actually due to what I call, and this is a word, type this into here, tensegrity. That's T-E-N-S-E-G, Tegrid, R-I-T-Y. You guys put that into the box for you. Because you see it, you can kind of understand it. And also I want for those who's going to be joining the broadcast later, that they can actually see these words and they can kind of look up and have an idea. They can, again, it's about education and empowering you, right? So if somebody can write that, MVPs, let's get in action. We're definitely participants, right? Into our own health and our own rebounding, getting our to our next. So put that down into the comment section for me. Tensegrity. Tensegrity is literally 10, like the number 10, and then segrity, S-E-G-R-I-T-Y. And conceptually what that really means is that you have tension and a structure. The tension represents the muscles, the ligament, the tendon, okay, the fascia, which is the connective tissue. And then the structure represents the bone. This is actually an architectural concept that was applied to medicine, but it completely made sense. And this is not just coming from me. This is like people who I look up to even trying to get this idea that you actually need this perfect balance of that muscle, that tendon, that ligament, that fascia to attach to that bone to be moving in balance. The idea there is if it's too taut, if it's too much tension there, that's excessive, right? You're going to have a problem there where they call tight muscles. And also if you have a situation where it's too lax, right? It's too lax, so it's not attaching in that right balance, then that's also an issue. What happens over time when you have an injury, sometimes it's not even an injury. Thank you, Dr. Rashana. In action, MVP, that's what I'm talking about. We appreciate that. So what we're having here is we say tension and muscle balance is important. If somebody can write that down. Tension of the muscle and bone balance is very, very important. You don't have to put very, very, but just put important. Again, we're talking about that. So if it's too much, it's a problem and it's going to cause pain and dysfunction and functional issues. Hi, Dr. Echoes. Thank you for rejoining the broadcast. Thank you. Welcome to the broadcast. Please click share, share this video and invite one friend so they can join into this information. I'll get it later on replay. And then the muscle and tension, of course, of the muscle is extremely important. If it's too lax, then that's an issue. So what happens if you have an injury is sometimes you guys are not having like an actual motor vehicle accident, but maybe you did. Or maybe you just do a particular job, be it at home or at work that you've done excessively just over the years, and all of a sudden you're having a shoulder issue or a back issue or a hip issue, and that just kind of crept up on you. It wasn't all of a sudden. That's in that same line of thought with the tensegrity, and if that's off. So what happens and I'm going to approach this as this is the bone, and this is where the attachment of the ligament or the tendon is. We're right at that interface, and you can't really see it, but right where it touches is what we call the enthesis, okay? Somebody write that down. I'm giving you guys some fancy words, but I believe that you can handle it, okay? Enthesis. That's E-N-T-H-E-S-I-S. Enthesis. Somebody write that down. MVPs, get in action. I know you guys got this. I want you guys to be able to come back to these words because I'm going to bring these concepts to you and bring them and break them down. Next week, what I actually want to do is bring a case to you potentially Don't quote me, but I'll bring it soon. It may not be next week, but soon, to drive this point home even further, okay? So anyway, the enthesis is where a lot of the blood supply is, but oftentimes when we have an injury or you have a diseased tissue at that level, that's something that we call enthesitis or enthesosis or enthesopathy. I guess somebody's laughing at there. But where the enthesis is joining is where the issue is, okay, at the end of the day. And we need to make sure that we bring more integrity and blood supply. Thank you, Dr. Rashad, exactly, enthesis to that area. So what happens is when your tissue, say you have let's go straight for a rotator cuff, for example, because that's a really great example, and you have incomplete healing. Sometimes you have gone through your physical therapy, right? You went through PT. You said, I did that for 3 or 4 months, Dr. Serena. I got some better, probably 80%, but it never went back to what it was before. How many of you guys can relate to that? How many of you guys can relate to you were hurt, you feel like you got some better, but you kind of always know that it's still there and you never quite got back to that same point, be it your shoulder, your back, your knee, your ankle, your hip, your elbow. It doesn't matter what part of the body is, but you feel like you did what you're supposed to do, and now you just have this pain that you feel like you shouldn't have when you do quote unquote simple tasks, right? That's where that comes in. That's where that tensegrity comes in. Because at this point now, you likely have too much laxity at that area. You have too much an issue with at the enthesis level, where now that blood supply was not sufficient enough, so your healing did not go all the way to 100%. It went to about 80%. So what happens now? Do you get prescribed a pain pill? Oftentimes you do, because what your doctor tells you is either A, right, you're not a surgical candidate. They say it's not bad enough for them to go in and fix anything per se. They could create more damage by doing it. How many can relate to that? Or, so you might not be a surgical candidate, or you feel like you've optimize as much as you could for physical therapy, and you continue to do the stretches, you continue to do the strengthening, but you're still not quite optimized that. Maybe you even believe that you're eating well, which we'll get into that in another video to kind of tie this concept, so that'll kind of be a part 2, but you feel like you did what you could. Well, where we are now at this point is that what we call ligament laxity, or we have enthesitis, okay, what happens at the level where the tendon, the ligament, the fascia meets the bone, did not completely heal itself. And a lot of times when we look at pictures, for instance, of tendons and ligaments, they're kind of white, right? Compared to the muscle where it's beefy and red. That's where a lot of blood supply in the muscle, or the blood supply in the bone marrow that's in the core of the bone. That's where our blood supply is. And when we talked about inflammation, or that cascade of events that occurs, that's what happens with the cascade of or the inflammatory response. But what happens is it was incomplete. That was what it was called. You know, it was incomplete. So what do we do next? What we do next? Hi, Sanada. Thank you for joining us. Welcome to the broadcast. Thank you for joining us. Share this video, invite one friend so they can get this information as well as we move forward, or they can catch it on replay. Thank you for joining us. So what do you do at this point once you realize that, okay, after definitely past 3 months, it's not really inflammation is your issue, but you still have the pain? What do you do now when you feel like you went through physical therapy and you maximize everything they told you to do, but you still have pain? What do you do at this point when you feel like you're still doing your stretches and you're strengthening, but you still have pain? What do you do now? What do you do next? Well, what is next in the field really has been going on for hundreds and hundreds of years at this point, and I'm just excited to bring it to on this platform to engage you all and empower you and educate you more, that you have more options, that even if it doesn't come in the form of a pill or it doesn't come in the form of surgery. And this is called what we call regenerative therapy, okay? Regenerative therapy. This umbrella comes in the form of PRP, which is platelet-rich plasma, which is your own platelets. It also can come in the form of a stimulating solution, which is also a natural-based solution that comes and goes right to the diseased tissue or the injured area. And with that, in that diseased tissue or in the injured area, we put a little bit of stimulating solution right there to initiate that cascade that stopped prematurely. Remember, we just talked about that you didn't get the complete healing. Your body almost did it all the way, but it kind of stopped short of that. A lot of times just because tendons and ligaments do not have great blood supply. So what we do is we give it a little jumper, okay? A little kickstart to to finish the process. And that is what regenerative and therapy is. So essentially, again, it can come in the form of platelets. It can come in the form of whole blood. Again, this is all yours, right? So all you're doing is taking it from your blood vessels and putting it and making it focus to that localized area of diseased tissue or that injured area that didn't completely heal. It's really ingenious, quite frankly, and it's just natural. It came from you. So you don't have to really worry about too much of any major side effects, right? And what it's going to do is initiate your own healing cascade, your own healing cascade, and it tells your body to start to release those immune cells, release those fibroblasts, release those collagen factors that are going to go down and lay down new collagen and new fibroblasts in that area of the diseased tissue to completely heal it. Why does steroid injections not do that? What do you mean? My steroid injection didn't do that? No, it didn't do that. Steroid injections are meant to decrease inflammation. Well, if there's not inflammation at that point, then what is it doing? You know, what is it doing at that point? Steroid injection is not really going to help. It can help. Again, it has its place too. But a lot of times, you guys are past that point and you're telling me, well, the steroid injections used to work, or the pain pill used to work, or I got better with therapy for a little while. It used to work. Well, that's where this piece comes into play. And sometimes even earlier. For some of you, I advise you to jumpstart that much earlier and don't wait till it's chronic, but hit it early where it's already acute. Now, where do my seasoned MVPs come into play? I never want to leave you guys out because it's not about if you're an athlete or not. This is not just for the, I hurt my rotator cuff playing baseball. This is also for arthritis, okay? This is huge because a lot of you, and I get this a lot recently, I don't know why, sometimes I get these surges of certain cases and they come all at the same time. But I had a lot of patients recently who have arthritis pain. They don't want surgery. A few of them didn't want surgery, or they have had surgery, but they still have pain. What can you do about that when you say, well, Dr. Zarina, I already had the knee replacement. What are you supposed to do about that? Well, what happens is even after the knee replacement, although the joint itself is an artificial joint, the ligaments around it are still there and they can be still injured, either A, from the surgery itself, or because they weren't ever really fully healed prior to you having the knee replacement. So we can help you with that as well with the regenerative therapies, okay? And I want, again, some of you may not be the seasoned MVPs, 55 or older, but you know somebody that is. You know somebody that's suffering with back pain, arthritis. You know somebody that's suffering with shoulder arthritis, finger arthritis. You know someone who's suffering with hip arthritis or knee arthritis. They don't want surgery or they can't have surgery. Sometimes you can't have surgery for other medical reasons, right? Sometimes your heart's not strong enough, but you still have pain. You deserve to have options too, okay? So that's really the point about this. You may say, oh, well, they told me I wasn't a candidate for some other reasons. Well, you can come into our office. We do a full comprehensive assessment to determine if you could be a candidate or not. It's very few demographic of people who are not candidates, quite frankly. There are a few that are not. It's not for everybody. But I promise you that what I've noticed is there's a huge population out there that are just completely left out of the opportunity of being exposed or having the assessment because they just don't know it exists. They just don't know anything about it. Let me ask let me answer a few questions. Anybody have any questions about what I've said so far? Again, thank you for joining us. Welcome to the broadcast. This is Rebound Your Health TV with Dr. Z, and I'm here to answer your questions about this regenerative therapy, about inflammation. You have any questions about inflammation? Any questions about why your pain pill doesn't have inflammation? I want this to be interactive as well, but I wanted to give you the foundation of the purpose of this conversation, because again, that's why I think our last post was something about it's not just for our young MVPs. This is for our seasoned MVPs. This is potentially for a large demographic of people, regardless of your age, okay? This is not really what that's about. If you have pain, then you deserve to not have pain. This is what this is about, pain freedom. You being in control of that and being empowered enough to know, oh, I don't have to have surgery. Sometimes you don't. Sometimes surgery is for some of you, okay? Again, these conversations are never about knocking other options, because I'm all about a plethora of options, but that was the point. Some of these things are just not as available to you because maybe your primary care doesn't know about it. That's not their fault. It's not even a bad thing per se. My point is that people specialists like myself, integrative pain management specialists, we just want to encourage you and bring you other options because you just didn't know about it. Okay? Any questions? Hi, Lolita. Who's Lolita? Who's Lolita? Hi, Lolita. I guess I was supposed to say hi, Lolita. Thank you for joining us. Any questions? And I remind you, sometimes, hi, Dr. Shara. Or did you, that might be an old one. But some of these questions may be coming in slightly delayed, but I don't want to ever leave you out. So what I often always do is after the broadcast ends, I'll go to the comment section to make sure I answer questions that for whatever reason didn't pop up during the live broadcast, okay? So I don't want you to be, don't fret. I'll get to them as well. But in the meantime, I didn't see any questions pop up right now, but I'm still going to continue to the next point about that. So I wanted to give you an idea of what all regenerative therapy includes. And somebody put that down, regenerative therapy, MVPs, put that down for me in the comment section. And then I'm going to list the types that are commonly out there. Number one, PRP, platelet-rich plasma. Okay, but you can just put PRP. Number two, whole blood. Okay, and this is all from you, self. Okay, yourself. The next one is a stimulating solution, and you can just put like stimulating natural solution. Okay, and that form though can come in the form of dextrose. Sometimes people use Serapin, which is a natural form stimulating solution. Some people use saline even. Some people don't think, hi, Dr. Rashawn, thank you so much for putting that in there. Regenerative therapy, yes. That some people believe that sometimes it's just a matter of stimulating that area with the diseased tissue, and some people say it doesn't matter what you put in. I'm not sure. I don't believe that wholeheartedly, but the point is that that is one of them. So number one, PRP. Number two, whole blood. Number three, stimulating solution. Okay, and then number four, but not least per se, is stem cell. Where they use even different, where they use ozone, again, your own. They use fat, adipose, they call adipose cells. That's being very highly studied as well. You can use fat cell, marrow cells from the bone marrow. Okay, these are, and I will give you in general the price point, I would say ranges from the stimulating solutions, whereas a natural solution such as those Serapins and dextrose, that's on the lower end. And then the higher end is a stem cell. But quite frankly, many of these, it doesn't really matter where you start, because some people may go straight to PRP or whole blood. Again, in our office, we will go through a full assessment, very comprehensive assessment to determine what is best for you, okay? Many people in my experience, my clinical experience, really do respond quite well, 75% plus for long-term, meaning their pain goes away and never returns with the stimulating solution. So you don't necessarily always have to jump to the $5,000-$6,000 therapies per se, but those are out there and you just need to know that. You need to know that they exist. So let me make sure, go back to the questions. I saw something pop up. Oh, there's a comment, not a question. Okay, awesome. All right, guys. Well, thank you for joining me. I didn't want to belabor the point, but I wanted to let you know those are the main things. To recap, that you're not inflamed, but you still have pain. Hi, Nikki. Thank you for joining us. Welcome to the broadcast. And what that idea is that sometimes inflammation is not the cause of your pain. Early on in the course of your pain or your injury or disease tissue or chronic overuse injuries, inflammation typically is one of the biggest culprits. But over time, when you get past that 3-month mark, it typically is not the reason for your pain. And that's why the pain pills don't necessarily work. And that's also be the opioids and such. They can kind of help a little bit, but they stop working, right? That's why your physical therapy, you feel like you did that, but then you didn't get 100%. Because there's an inherent tissue tensegrity issue, right, that occurred that didn't quite get 100% healed. And what regenerative therapy does is it helps initiate your own body's human healing response and mechanisms to initiate a cascade at that area of diseased tissue or injured tissue. We put a stimulating solution there that is natural, or your own blood products right there at that level, and initiate again your bodies to start sending the response to heal it completely, or to heal it almost 100% completely. That is the idea behind that. And I'm so excited to also let you know that we do have a discovery session where I do a virtual assessment or a virtual conversation with you guys we're virtual, exactly. If you reach me at rim-group.org, going with my blank, or you can actually email us at info@drzarina.com, probably easier, info@drzarina.com to schedule your discovery session. This is a free consultation, 15 to 20 minutes to let us know how we can get you to your next. And I can also go over with you. And actually, the nice thing about this, there's also now our ability to be able to get a coaching program. I'm so excited about this, guys. It's our Pain Freedom Program, 101 virtual for 6 months. And I'm so excited to let you guys know if you're not in Georgia, I can still now help you. That's what is so, so critical. And you can also reach us at info@drzarina.com to get more information about that. If you live outside of Georgia, even if you are in Georgia, you can still have access to that. But definitely reach out if you're having some issues, you just kind of need more help. And this goes over so much, and I can't wait to tell you more about it. But it's just not touching on, what physically is happening or hurting there. We're going to go over integrated nutritional needs, sports nutritional needs. Even if you're not an athlete, integrated nutritional needs. We're going to go over mindset and how that impacts your pain and prevention. So much, so much, so much. And we're so excited to bring this, guys, to you. So please reach out if you need any help. Info@drzarina.com. That's info@drzarina.com. Can't wait to see you guys some more. We're going to come back to you with more Rebound Your Health TV with Dr. Z. Thanks for joining us. Don't forget to share this video. Don't forget to invite friends to come and share the video, and as well as get some more help and empower. You guys know me. I'm Dr. Zarina, also known as Dr. Z. Go into your week as MVPs, that mindset, and I'm going to see you guys next week. Mwah!